So you must have created lots of lives, sir, so far.
Yes.
So like approximately how many lives have you created, sir?
So if compared to embryos, I'll be like around 10,000 might be
10,000,
embryos,
yeah.
but live birth means babies, it's like around 1,800 or 2,000.
Okay, sir. So how do you feel, sir? Like it's a natural process which God gave us. Like you are in lab, you are creating life. So how
Yes.
do you feel about that,
Yes,
sir?
most of my friends they will be telling like we are like little Brahmas. It's not the case, because above all there is God actually. So we are assisting the people with the help of gods. That's it. The thing is, they will be like creating a life. It's very crucial thing, because we are in our hands. Actually, the life is there. So that itself will give a lot of positive vibes to us actually. So many of my friends they will be asking, so how is your experience in embryology? Like the thing is, every jobs will be getting the money. That is not an important thing, but job satisfaction. That is the one important thing which I'll be getting from, because everyone will be having the job satisfaction. But compared to our field, like when we are creating a life, so we are holding the life in our hand. So we are transferring with the help of doctors. We'll be transferring that life into that means mother's womb. After 10 months or 9 months, we'll be getting that baby in. So when they are bringing that baby to us, so when we are holding that baby, it's like that happiness will never be replaced by any other thing. So that is one of the important, like in embryology, that is one of the important advantage we have. So we are pretty much happy to have this.
So after creating a life, sometimes it might come positive, sometimes it might come
Yes.
negative. So how do you take both, sir?
The positives and negatives both are very crucial for us, because positives, it's a good news for everyone, even for patients as well as us. But negatives is it will have a big impact on us. So patients, it's not only with patients, even for us. So we'll be analyzing each and everything, what went wrong actually, whether it is embryos or endometrium. So we'll be thinking a lot of things about that. So each negatives, it's like a nail to on her head.
So even you are not connected to the patients directly, but you feel emotionally very connected to them.
Yes, we are always behind the curtain, because but the thing is, we are looking for each patient. So we'll be counting each day. So if you are transferring the embryos, so it will take like around 13 to 14 days to they should come for test actually. So we'll be waiting for that days actually. We know everything, so we'll be waiting. So what will be the results? Some patients will be transferring that the embryos will not be that great. That patient will be having some inherent problem. In that case, actually, the embryos might not be that great. So, but we will be praying actually more than the patients. We will be praying. Okay, they should get positive. So it's very important thing for us.
So, sir, while egg retrieval, there are many eggs, like 10 to 15 eggs,
Yeah.
20 eggs. So, how do you calculate, like, which is the best one?
Yes, we have a strict protocol actually. So based on morphology and the growth pattern, so we will be selecting the which embryos will be very good. The thing is, all oocytes will not be great. Even we are taking the oocytes from the same womb, same ovaries. What will be the problem is actually some oocytes will be great, some oocytes will not be great. So on day 0, we can't find out which will be that great. So by morphology, we will analyze. But when we are injecting the sperm inside the oocyte, so we have to let it for like around 5 days to grow. In that 5 days, we'll come to know about how it grows actually. So whether it is forming, first of all, some embryos will not be forming because there is some problem with sperm or oocytes. It will not form. But some cases actually this will happen. But most of the cases we'll be having like out of 10, we'll be getting like around 8 embryos, means 8 babies. So we will analyze this growth pattern. For next 5 days, we will analyze the growth pattern, how it grows, how was the quality on day 1, on day 3, on day 5. So based on that quality, we will be selecting the which embryos will be very good. So we'll be selecting 1 or might be 2. So we will be transferring that back. So selection is very important pattern. We have to analyze the 5 days growth. Based on that, we'll be doing.